This is a video about neurovascular bundles of the arm. We'll consider the course and distribution of nerves and possible injury sites for those nerves, and also the course and distribution of arteries. There's quite a few principles that you may need to consult. The most important one for the beginning of our discussion is NP6, which says the course of an anatomical structure can be defined in terms of where it starts or its origin, where it ends or terminates, and how it gets there, i.e. the major anatomical relationships it has on its way from origin to termination. And some other principles related to venous and lymphatic drainage, as well as arterial supply. Important ones to pick out from these principles: V3, arteries and veins are continuous throughout their course but tend to change their names in different regions of the body, or where they branch or receive tributaries respectively. They often have a name change there. Principle V4, within the body, nerves, arteries, veins and lymphatics tend to travel together, forming what we term neurovascular bundles. And principle V12, that arteries commonly anastomose or form a network of extra connections around joints in order to provide effective circulation to adjacent tissues or regions, regardless of the position of the joint. So this is an image taken from the Moore textbook, and in it we can identify the neurovascular bundles of the arm. So here is our elbow. It's a medial view coming up to the medial aspect of the shoulder and axilla, and we can identify in red and yellow the neurovascular tissue. So the yellow tissue depicts nerves and the red depicts arteries. Things to identify here are the musculocutaneous nerve, the median nerve travelling along with the brachial artery, and also we can see the ulnar nerve. And we will take a moment now to identify these structures on a model of the upper limb.
So this is a model of a right upper limb. We can see the arm region, the scapula, so we know this is the medial aspect of the arm. And we want to look at the neurovascular structures. So the first things to identify is the nerves are shown in yellow. We trace this structure down here. This is the median nerve in the anterior compartment of the arm. And then running alongside that is the ulnar nerve. We'll zoom in now to identify the musculocutaneous nerve. So on the zoomed in shot, we can identify the scapula covered here with muscles and the coracoid process, just to orientate you as to where we are on the model. And again, we can see part of the median nerve that we just examined. Just next to that is the musculocutaneous nerve, travelling here to pierce the coracobrachialis muscle. And we can't see the radial nerve because it's obscured by these anterior structures. This is a posterior view of the same model, and we can identify the clavicle, the humerus and the scapula posteriorly covered with muscles. And two nerves that we can see now include the axillary and the radial nerve here, travelling between the heads of the tricep muscle.
So now that you've seen the location of the neurovascular structures on the arm model, let's come back to our learning objectives, which require you to identify the course and distribution and anatomical relationships for the neurovascular structures. And we'll go through an example for the ulnar nerve and also for the brachial artery, and then I'll set you a task to complete as some private study time. So for the ulnar nerve, we need to consider the origin. The origin is the medial cord of the brachial plexus, and it's therefore derived from the C8-T1 anterior divisions of the spinal segment. Relationships, it's found in the anterior compartment and is located medially. It pierces the medial intermuscular septum, which you'll recall is one of the boundaries of the anterior muscle compartment, and travels posterior to the medial epicondyle. There are no branches of the ulnar nerve in the arm. So moving on to an example for a blood vessel, in this case the brachial artery. The origin of the brachial artery, it is a continuation of the axillary artery, and the name change from axillary to brachial occurs as the vessel travels distal to the teres major muscle. Relationships, it's located in the anterior compartment and is found medially in that compartment and accompanies the median nerve, brachial and basilic veins, as well as some lymphatic vessels. It supplies the anterior compartment structures and forms anastomosis at the elbow joint. And the termination of the brachial artery, terminal branches are located in the cubital fossa, and they are named the radial and ulnar arteries that will travel on to supply the forearm. So for the other nerves, i.e. the median, muscular, cutaneous, radial and axillary, your task is to complete the same type of information. So to write some notes about the origin of those nerves, the relationships and the branches that they form in the arm, and also for the profunda brachii artery to write down the same sort of information that we just went through for the brachial artery. So again, the origin, relationships, structures that are supplied by the deep brachial artery or profunda brachii, and the termination of the structure. Moving on to cutaneous nerves, we'll just do a brief moment of revision of dermatomes that you would have learnt a little bit about in first year. An important principle, NP13, tells us that the dermatome is a pattern of sequence of areas of skin arranged distally along the pre-axial border and then proximally along the post-axial border and innervated by progressively more inferior spinal segments. So it's a map of the common distribution for cutaneous innervation, and you can see that as we go along the pre-axial border we're moving distally, and as we go along the post-axial border we're moving proximally. So some named cutaneous nerves of the arm that it's good to know about include the superior lateral cutaneous nerve, the inferior lateral cutaneous nerve, the posterior cutaneous nerve, and the medial cutaneous nerve. So it'd be a good idea to look up the spinal segments that give rise to those cutaneous nerve structures. Moving on to some clinically important neurovascular bundles, we'll discuss the likely or common sites for injury to particular nerves in the arm. So we can identify here the axillary nerve in the quadrangular space, the radial nerve travelling in the spiral groove along the humerus, and the ulnar nerve travelling posterior to the medial epicondyle. Each of these sites are vulnerable locations where injury can occur to the nerves. So in the axillary nerves case, dislocation or head of the humerus fractures would be likely to cause injury to the axillary nerve, whereas the radial nerve is vulnerable to injury from fractures of the humerus as it travels in the spiral groove of the humerus shaft itself, and the ulnar nerve is particularly vulnerable to compression or bump type injuries as it's quite exposed as it travels posterior to the medial epicondyle. So as a reminder, you have a few activities to work through, completing the course, i.e. the origin, relationships and branches for the rest of the nerves and the blood vessels listed on slide 9. You can check your answers on the relevant forum and as always post any questions on the relevant forum.